Welcome to the Doctors in on CNN Philippines. I'm Dr. Freddie Gomez. As the number of cases of COVID-19 increase, so does the associated anxiety. And as quarantine measures are in place, its effects on many people's usual activities and livelihood continue to bring about levels of loneliness, stress, and anxiety in the population at large. So a recent study published in the Lancet Psychiatry Journal warns that the mental health effects of the COVID-19 pandemic might be profound and can cause distress, leaving many people vulnerable to mental health problems. That's why, apart from being physically active, we should also be conscious of our mental well-being. So to enlighten us on this topic, I'm glad to have Dr. Lovie Hope Go-Chu, a psychiatrist from the Makati Medical Center, to join us. Welcome to the show, Dr. Lovie.
Yes, I'm here, Dr. Freddie. Hi.
Okay. Now, how do times of uncertainty affect our mental health in general?
Well, the pandemic now, it's really unprecedented. I don't think anybody would have expected to see this in our lifetimes. And because of that, it's causing a lot of uncertainties. Uncertainty because, you don't know if you're going to get sick. You don't know if your family members are going to get sick. We don't know if pagbalik pa ba nito, like we still have work, like if we still have income. Because on top of that, we're on this enhanced community quarantine. So maybe some of us are like getting on each other's nerves, and the others naman, they can't like be with their loved ones. So, we're really looking at a lot of uncertainties at this point.
Now, of course, like what you mentioned, it's unprecedented, this current situation that we are in. But maybe a lot of people are accounting everything that is going on, their anxiety, their stress, to things being normal. When are things no longer normal, Dr. Lovie? So what are some of the telltale signs that a person's mental health may need some attention?
Okay, you're right. I'm glad you said that, Dr. Fred. Because like a lot of these things that we're experiencing right now would be normative anxiety, and we don't have to treat that. Sometimes we just have to like talk about it, and that would be like a big help already. It will become a point of concern if and when this anxiety, the irritability, the depression, the sleeplessness, if it already starts to affect our relationships, if it starts to affect like the way that we work, like for example, because you were not able to sleep the previous night, and then you make a lot of mistakes at work, and then you become like so irritable to the point that relationships are already being affected, that might be a cause for concern. But otherwise, if it like comes and goes just like that, after like a few days it's gone, and that would be okay. But if it like lingers on and it gets to the point that it's affecting like your daily activities, then that would be a point for concern already.
Mm-hmm. Okay. Now, as a lot of people know, the show caters to a lot of viewers' questions, and we'd like to take a look at some of the video questions that were sent to us online, Dr. Lovie. So if you could help me take a look at the first one from Tin Ilagan. Let's take a look at this.
If we're feeling stressed and anxious, when is the right time to ask for professional help?
I'm sorry, the question is like if somebody's stressed and anxious, if you have to get professional help, is that correct?
Yes. Yes, that is right. When would be if someone was feeling stressed and anxious, when is the right time to ask for professional help?
Okay. As we said earlier, being stressed and being anxious, that is a very, very normal, reaction at this point. I think the abnormal thing at this time would be not to be anxious, So as I said earlier, if your stress is like causing you already not to be able to function, if it's causing you not being able to sleep at night, if it's causing you to be like so irritable to the point that it affects your relationships with other people, if it affects like, your capacity to like be productive, then that will be the time for you to get help.
Okay. So we have another question here from Ging Santiago Carrera. Let's take a look at this.
Pwede po ba maging sanhi ang stress o anxiety ng mas malala pang sakit?
Okay. So Jing's question, Dr. Lovie, is pwede po bang maging sanhi ang stress o anxiety ng mas malala pang sakit?
Kung pwedeng mag-cause ng mas malalang sakit ang stress and anxiety, tama ba? Is that the question? Okay, so that's a very good question, no? Any
Yes.
form of stress or anxiety has the capacity to become like a trigger, like a stressor. Definitely, a lot of the stresses and anxieties will stay just like that, parang adjustment lang. Once we adjust to a situation, after some time, it gets better. However, like with for some people, if it becomes like so high, the level of stress and anxiety becomes so high, then it can become a trigger for like a depressive episode, a clinical depression, or maybe clinical anxiety. So it depends on the person. But a lot of this will be self-limiting. But some cases, definitely, it could be a trigger for something more serious.
That's right. I agree with that 100%. Things could be a trigger, so they have to watch out for those. So we have another question. This one is from Kath Panganiban. There we go. So let's take a look at this one.
Madaling araw na po ako kung makatulog. Makakadagdag po ba ito sa stress?
I'm sorry, ano raw, Doc Freddie? Ano raw? Ang static kasi comes across as static.
Kath's question, right. So Kath's question was, madaling araw na daw siya nakakatulog, nakakadagdag pa ba ito sa stress? Yung pagtulog niya ng madaling araw na.
Okay, so that it's like this, no? It depends on like your baseline. Some people kasi, kung talagang madaling araw naman po ang tulog ninyo, tapos hanggang ngayon madaling araw pa rin, baka that is already like your routine, no? However, if kung nung dati before mag-enhance community quarantine, pag hindi ganun ang tulog ninyo, sometimes you can still make a little allowance kasi the following day naman we're not expected to wake up and to be in school or to be at work at a certain time. So maybe we can make a little allowance for that. Pero what you don't want to happen is to totally reverse like the sleeping pattern. Ang problema kasi niyan is kapag nabaligtad na ninyo yan, so totally disrupted ang routine ninyo. Well, one, definitely after nitong quarantine, baka mahirapan tayong bumalik sa previous sleep-wake cycle natin. The second one is we don't want to disrupt the routine. And at this point, when everything is so uncertain, we want our routine. So routine is very important in our lives right now. It gives us a certain sense of predictability and stability that will help us through this very uncertain time. So it depends talaga on the situation. But preferably you stick with the routine, with the sleep pattern that you have been used to.
Okay, so those are a lot of tips that we've learned so far from Dr. Lovie Go-Chu. But first, we have to pause for a quick break. And when we return, we will give you tips on how to handle difficult and stressful situations during a pandemic. Stay tuned. We'll be right back. Welcome back to The Doctor's In. I'm Dr. Freddie Gomez. So before the break, we talked about how the COVID-19 pandemic may affect one's mental health. Ngayon naman, let's continue our discussion by sharing with you important steps in managing stressful situations. So still with us is, of course, Dr. Lovie Hope Go-Chu. She is a psychiatrist from the Makati Medical Center. So let's continue the discussion, Dr. Lovie. When it comes to managing stressful situations, one thing that I hear about is having a support group with you. So how important is it having a solid support system?
Doc Freddie, having a support system is very, very crucial. By nature, we human beings are very social, so at any point, you don't have to have a lot of friends, so long as you have maybe a few people that you can really be with, in times when you're feeling distressed. So kahit na a few family members, a few close friends, definitely that will help you through, this very difficult time. Because the thing is, if we're feeling bad, we need to be able to like verbalize it and to like vent, if you may, with someone. It doesn't have to be a professional. So long as you're comfortable with that person, you're able to like discuss and like verbalize like all of these things that you're feeling inside, then that will be a big help already. So support system is really quite crucial at this time.
Yes, speaking of support system, Dr. Lovie, how do you think is it possible to reduce the stigma uh, on patients or probably recovered patients as well as health responders who have gone through this COVID-19?
Um, that is a very tough question, Freddie. And I think a lot of like experts have tried to figure it out. Well, you have those things like like honoring like those people who passed away, or like the healthcare workers. I think this one is more pronounced with the healthcare workers and no? Because like the frontliners are always exposed, and they get like ostracized and stigmatized and all of that. Well, one is would be like to honor the work that they do. So you have like all of these like media campaign, like thanking them. But that one doesn't like really take away like how it doesn't really like change like all of these people if they're very discriminatory. That doesn't change. So I really don't know like how we can do that. I think it has to be like, I think there are like laws which would prevent like this kind of stigmatization. And PMA, the Philippine Mental Health, the Philippine Medical Association, the Integrated Bar Philippines, they have all like come out with like statements in support of these healthcare workers. And I think a lot of
Now, in every yes,
I'm sorry. And education also, like like after these people, like after they have been diagnosed and they've been treated, then then they won't be able to, they won't be like infectious anymore. So like proper education would be a big factor also in helping destigmatize.
now in every pandemic situation or in every uncertainty or any stressful situation, different people have different ways in which to cope with that situation. Now, could you give us some tips on how to manage these kind of situations, especially the one that we're in now, where there's a lot of uncertainty? So, what's a good coping mechanism with where we're in right now?
The coping mechanisms, that will really depend on the person, because at this time we cannot like suddenly channel like some coping mechanism that hasn't like worked for us. What will really work is what has worked for us before. So we want to think like in the past, after I have been I've been in very difficult situations, what has helped me. So maybe like some can be like proactive, like trying to figure out solutions in the problems that that they're having. If they don't have income, like how can I make this carte and try to like make money? Like can I sell something online, whatever? So you can try to figure out solutions. Like others naman will help just by being with family, like talking with family, like like being with them, like spending time on social media with their families. Like some would rather like be on their own, and they can like be spiritual about it, like appreciate nature. It really depends. And some would be like their religion, they cope with religion, which is for Filipinos a very very common and effective coping mechanism. So there's really no one quick fix for like that will apply to everybody. What you want to know is what has worked for you before, and you want to go back and maximize that. But
Now
of
let's
course,
answer some
if
of
you
your questions about mental health. Oh, yes.
uh-huh. I'm sorry.
Yes, you were saying something, doctor. You were saying something.
Yeah, I was just saying that there are like some basic things, like definitely you have to take care of like your physical health. Make sure that you're healthy, you're eating properly, you're exercising, because all of that, if you're healthy and you stay off like mga substances, mga alcohol, drugs, because that one can in themselves, they can cause like depression and anxiety. If you can take care of your physical health, then it makes you more capable of facing this infection, and it will make you more confident with your if your physical health is taken care of.
All right, fair enough. Now let's shift over to our online questions, and let's answer some of the video questions that they have with regards to mental health. We have a question from Jerin Batallones. Let's watch this.
What simple activities could we do to improve our mental health while being stuck at home?
Okay. As I said, there are like
Were you able?
several ways of
Okay.
like yes of managing. Well, one, emotionally, what you can do is that first is you have to recognize already these emotions. If you're distressed, if you're feeling like anxious, first thing is that you recognize your triggers, because only if you recognize will you be able to do something about it. Okay, so recognize, like once you recognize, so you think, anong makakatulong sa'yo? Do you want to find a solution to it? Do you want to talk with somebody? Or do you want to like write it down, like make a journal? Or do you want to like maybe reflect and practice like mga mindfulness techniques? So recognition, that is the most important thing. Then you can start to do something about it already. You have to be in touch, like, with how you're feeling. Otherwise, what will happen is that magpapatong-patong na lang yan until at one point na parang pagod na pagod ka na lang if you don't recognize like all these negative feelings are like piling on. Some people will cope like intellectually also. And ito yung mga yung sinasabi natin, yung dami-dami ng mga amateur na mga chefs and mga linguists, because they try to like learn new skills, and that is really very helpful because it stimulates the brain. At the same time, it distracts you from like all of these anxieties brought about by this pandemic. And then like other people also, like as I said, there are like depending on your level of on your beliefs. You don't have to be like religious. Like some people through religion talaga, like praying the rosary, like every night merong rosary time where like everybody gathers together and prays the rosary. But some people, even if you're not religious, you can do things that are quite spiritual. You do things that like that give meaning to your life. Like for example, some people will want to like help other people. So gagawa sila ng mga ang ganda nga, nakatuwa to eh. Like they would like do like gagawa sila ng mga face mask, gagawa ng mga shields, and by doing that, they're helping others, and that is the way that they help naman themselves. So that is like altruism, which is a very good coping also. So again, you have like all of these things, walang tama, walang mali. You just do whatever like works for you, so long as hindi maganda yung mga ineffective coping and parang self-destructive, like yung mga alcohol, yung mga ganun, hindi na nakakatulong yung ganun. But other things that will make you better, things that will make other people better, it doesn't matter kung ano man, whatever works.
Okay, now we have a last question here, our last video question from Jonalyn De La Cruz. Let's watch this.
Meron po bang mga mind exercise na pwede namin gawin to lessen stress and anxiety?
Oh yes, definitely. If you're asking for like mga physical na mga na exercise, you can do like mga sa YouTube, marami niyan. Depending on your level, you can do like mga yoga, mga simple lang na yoga. Definitely at this point, you want to stay off yung mga intense exercise, kasi kapag nabalian kayo, parang nagkasakit kayo, sumakit yung katawan ninyo, mahirap pumunta ng ospital. So at this point, depending on your physical capability, pwedeng mga mild to moderate exercise. Yoga is good because it connects the mind and the body. May mga breathing exercises. It helps you focus on the here and now. So you can start with that, like maybe a few minutes. Like if you're not naman into like yung sobrang mga physical, you can also do like mga mindfulness techniques. So that one is just like helps you like focus on the breathing. It helps you be in the present so that you don't keep on thinking about what could happen, what happened, because those are the things that will cause you anxiety. So definitely, you're right. Like all of these exercises are really good, whether it's for the brain or it's for the body. That's they're both good in helping cope with anxiety at these times.
Okay, so thank you very much to all those who sent their video questions online on the CNN Philippines Facebook page. We hope that we are able to give you some helpful answers. Now, before we go, Dr. Lovie, do you have a message for our viewers?
Anxiety at this time is really very, very normal. You know, it's okay if you have that. It doesn't mean na parang mahina kayo, mahina ang loob ninyo. Everybody is going through anxiety at this point. The important thing is that you take care of yourself. You know, you take care of yourself like through physically, emotionally, intellectually, spiritually, socially. Those are the ways that you take care of yourself. And if you're able to do that, you know, we'll be able to like get through this. But if you're having difficulties, like as we said earlier, if it's becoming to the point that, you know, like all the things that these things that are happening to you, like all of the anxiety, if it's getting to the point that it's affecting like your relationships, your capacity to be productive, then there are always people, professionals, psychologists and psychiatrists who will be able to like help you.
Thank you very much, Dr. Lovie Hope Go-Chu, for being with us once again on the show and for sharing your knowledge with regards to trying to keep our mental state healthy.
Thank you, Doc Freddie. Pleasure to be with you again in your show.
And we will see you again tomorrow at 3:30 p.m. here on The Doctor Is In, only on CNN Philippines. I'm Dr. Freddie Gomez. Stay safe, everyone.